Moving on to part 2 of the series of lectures to do with safety and quality in clinical practice. So you should now understand what a clinical incident is and the definition of such, and know that they can range from the simple to the very complex, but it's anything that places a patient at risk of harm or actually harms them. So closely associated with that are examining factors contributing to clinical incidents occurring, and they are generally categorized into two main sources, and they're human factors and system factors. Human factors constitute things to do with skill, error of judgment, or a rule violation. So things like, I've given you the example there, forgetting to check a blood glucose level before administering insulin, an error of judgment, you don't assess properly, for example, prior to giving analgesia, or you knowingly violate a policy guideline. For example, medication administration. Don't do checking procedures correctly, so it's a rule violation. Now, system errors are those related to institutional factors that are something to do with systems in place in healthcare that don't work properly. And there's been a lot of research and reports sort of set up to look at this. The Incident Information Management System, which has been on the go for probably the last 10 years, has certainly had a lot to do with making new recommendations and implementing systems in place which are designed to make safety and quality in clinical practice and healthcare systems better. A lot of research has focused on the fact that one of the main system factors that contribute to a lot of mistakes occurring or sentinel events occurring are to do with communication. For example, verbal communication between healthcare providers and, healthcare workers. And to give you a very local example of that, just think of communication, for example, in verbal handovers. Now, that's a type of synchronous or real-time communication process that, if done well, is vital because it allows for clarification, clear up any misunderstandings of treatment protocols about patients between, shifts and so on. It can also, communication can go awry between healthcare providers or healthcare workers and actual patients when miscommunication occurs. And also, documentation is a major area where mistakes occur or near misses occur, or it's not actually done in relation to communication. Supervision is another area that has come up in the top 10 of system factors. So, lots of systems, but generally it's a breakdown in a process that results in a situation occurring. One of the good things with these Incident Information Management Systems, or your IMS report, is that sometimes you can think that even if it's a minor miss, you think, oh, should I bother doing this? But remembering the reporting process is vital. Obviously protection of the patient and so forth, but these management reporting systems are vital in that they precipitate the development of statewide programs that will, be useful for staff. And to give you some example of some that have occurred in the last 10 years, the Between the Flags system. That system or policy was brought in as a result of all the near misses and incident information management reports that came in about not recognising deteriorating patients and so forth. Closely associated with Between the Flags was SAGO charts, or the Standard Adult General OBS chart, which clearly the colour coding again facilitates the escalation of, reporting or reviews for patients who are deteriorating, detect. There's a training system that came out, obviously. So lots of good things come out of these reporting systems, and that's why they're so important. But just to summarise, know that factors contributing to clinical incidents, two categories, human and system factors, and that chapter you've been given to read covers that well. Managing clinical incidents, just a little bit of an overview of this. Again, you won't be tested on this per se. It is a very massive area, but I think just knowing the process that's involved. So incidents are identified through observation. They're also through coroner's reports, through staff meetings, complaints and audits, etc. So whenever there's a situation that's continually occurring or a one-off, well, they can be reported and identified through a number of means. But following an idea of an incident, it's necessary to take immediate action to mitigate harmful consequences, remembering, depending on the type of incident, but protection of the patient is uppermost. Care of the patient, staff of who are involved in the event. You've got to make the situation safe. And if it's, for example, malfunctioning equipment or something like that, you have to remove it. And then there's an actual investigation, gathering information. For example, if it's a situation of aggression that occurs in an emergency department, it might be police or security information or something like that. All staff members are required to notify all incidents or near misses, and as I've said, the repository for that is the Incident Information Management System, and all clinical incidents are documented in patients' healthcare records, and they're given an ID number and they're followed through. There's a classification system for the level of severity. A severe incident or a sentinel event, as you might sometimes see it written, is a SAC 1 or a Severity Assessment Code 1, and that's where obviously a patient might die or something very dreadful happens. There's a root cause analysis or investigation conducted, and the aim of this analysis is to understand how and why the incident occurred and to identify ways of improving the systems of care and prevent recurrence. All right, so again, big process, but just have an awareness of some of the terminology there. Now, just a final note on responding to mistakes, and it's really important that nurses deal professionally and ethically with clinical errors and incidents. Again, it's highlighted in your code of conduct, your code of ethics, and your standards for practice. And one of the uppermost things in terms of a legislative framework is protection of the public. Now, self-respect is important, and when you read the chapter from Atkins, it's, self-respect, living up to standards that the profession sets, and when we do, it's we build our own self-worth and we gain self-respect. And happily, along with paramedics, nurses are still one of the most respected professions. But from an individual perspective, if you don't respond appropriately or you make a mistake at work, you might feel very embarrassed or humiliated. But the good thing about that, for example, to give an example, if you give the wrong medication at work, I can guarantee if you do it once, then that can be a really powerful motivating factor never to make that mistake again, because you might have a look at, for self-reflection. Was it a rule violation that you inadvertently did, cutting corners, so you change your practice? So that's a good thing. Every profession has expectations of what constitutes doing a job well, and when a nurse lives up to that standard, they become worthy of respect. When you've got nurses who lack self-respect, it can be really problematic, and they're at very high risk of being exploited or manipulated by a culture where there is lots of wrong things going on because they fall into that. they don't meet standard, and they don't have the ability to speak out. They might have the lack of motivation to perform well, and it's all about they have a don't care attitude, and that's why burnout in units is really, really important. It's a very, very complex area, but nonetheless, having the courage, honesty and integrity to report mistakes and do the right thing from the get-go is really, really important. It's all about patient-centered care because, again, it's important to understand the trust that patients have in nurses, and when nurses make a mistake, their trustworthiness can be called into question. So you just imagine yourself as a patient, and when you have a nurse who's got a don't care attitude and, you know, they are very flippant in sort of, you know, giving you the wrong medication, or there's a near miss with your medication, they have something, they go, oh, sorry, that's meant for Mrs. B. That really does go to the heart of the trust that you have in that person's ability, but just a whole range of things. So patient-centered care is really important, and the whole issue of when you do make a mistake, being honest and having the courage to report, because concealment is the absolute worst thing you can do. And you've looked at a number of cases throughout this subject to date to know that when a situation or a complaint is made, and it's usually as the result of some form of clinical incident, and when the individual nurse, and the example we've looked at again and again is Bhavesh Shah, the nurse who gave detergent, one of the main things they did wrong was not report it immediately. They weren't patient-centered, and they put themselves first, which is against everything that we hold within the standard of nursing. So to summarise, when an error occurs in the clinical practice, it's important that immediate action is undertaken. Know the factors that contribute to clinical incidents occurring, human error versus system error, and from your own personal perspective, always adopt a patient-centered approach when framing your response and action should you ever make a mistake at work. So thanks.